Professor Nana Jane Opoku-Agyemang. Please remain. The national anthem. Thank you for the KGL group, the KGL Foundation, whose philanthropic hearts and hands have built the space of healing. Bless their generosity and may their cups overflow. We thank you for our father, His Majesty Otumfuo II. His visionary leadership for Asanteman continually inspires development and progress, granting continued strength and wisdom. We further thank you for Lady Julia Osei-Tutu, his worthy consort, whose dedication through the Veep Medical Foundation has made quality health care for women and families an everlasting.
Productively, a mentally healthy person is not merely somebody who is employed, somebody who is empowered. She contributes meaningfully, creates, innovates, and leads. As our national data shows, poor mental health reduces our productivity up to about 7% of GDP and drain the economy, while good mental health fuels growth, stability, and national progress. Mental health is the capacity to contribute to your society, which our forefather, Dr. James Patrick Agri, wisely taught us that if you educate a man, you educate an individual. But if you educate a woman, you educate a whole nation. In mental health, this truth becomes even more profound, because when you heal a woman, you heal a household. When you strengthen her mind, you stabilize a family. When you empower her emotionally, the nation itself stands tall. In Ghanaian homes, from the bustling cities to the quieter hamlets, women are the first responders of care, especially in times of mental distress. And in Akan, they will say that so the chicks always follow the female, or they'll follow the hen. So we need the hen, we need our women to be healthy, mentally healthy. They carry the burdens, the anxieties, the unspoken words of entire families, often while beating their own struggles. They say that the fire that warms the household is the same fire that must be protected from burning out. If our women are the caregivers of this nation, then their mental well-being must be treated as a national treasure, protected, nurtured, and prioritized. This is why today matters, because by strengthening the mind of the woman, we strengthen the hearts of Ghana. Across Ghana, more than 1 in 5 people live with a mental health condition at any given time, yet the treatment gap remains very high. Access challenges, stigma, limited mental health infrastructure, shortage of trained mental health professionals are all widening this gap. We remain profoundly grateful to His Majesty Otumfuo, Her Royal Highness Lady Julia, for this visionary support. The establishment of the Veep Medical Center, therefore, represents more than philanthropy. It is a strategic national investment. It is an
instrumental in this. The medical teams who work here, we're grateful for your dedication and compassion. To the partners and collaborators, especially, of course, the KGL Foundation, obviously led by the chairman of the foundation, Mr. Alex Apaodade. Your vision and commitment has made this possible. We say thank you. To the communities that we serve, this center belongs to you. And to you, we are honored to serve you. And to every woman listening today, you deserve care that sees you, respects you, and supports you. This center is here for you. Make use of it. Let this opening be not an ending, but a beginning of healthier lives, stronger partnerships, and a brighter, more sustainable future for all women. Thank you, all of you gathered here to witness this occasion, and I say you're very much welcome to the commissioning of this center, which will serve our women in a wellness, in a holistic manner. Thank you so very much for your kind attention.
Many health conditions, including mental health conditions, can be treated effectively and affordably. Yet, as a nation, we are confronted with an uncomfortable truth. That is, the gap between those who need care and those who receive care is unacceptably very wide. I mean, about 7 people out of every 10 people who need help don't get mental health care. Today's commissioning is therefore not just an opening of a building, it is the opening of a door to access, a door to dignity, a door to healing, and a door to hope. Mental health is more than the absence of an ailment. It is the foundation of our ability to live meaningfully, to relate with others, and to thrive. Drawing from evidence in our national landscape and from the wisdom of Minya Dume. I am an every born in Kumasi, and Minya Dume means a Nesafo group. Allow me to frame what mental health in 4 simple yet powerful pillars are. So, 1, mental health is the ability to cope with life stresses. In Minya Dume, we say when the storm rises suddenly, it is the tree with deep roots that remains standing. A healthy mind is that rooted tree, flexible enough to bend, strong enough to endure. When our women carry the weight of homes, workplaces, childbirth, trauma, and societal expectations, their mental health becomes the quiet pillar that sustains the entire community. Mental health is the capacity to realize one's God-given potential. And here, the others in Nyansa Krom will tell you that a seed that is never nurtured will never reveal the forest hidden within it. When a woman's mind is nurtured through care, support, therapy, or timely intervention, she blossoms into the highest, self-esteem. A nation that invests in the mental well-being.
The Ghanaians are ready for change, but readiness alone is not enough. This crisis demands infrastructure, it demands steady funding, and above all, it demands our courage. And that is why we are here today, opening the doors of a new health facility, built through a partnership between KGL Foundation and the Veep Medical Foundation, under the patronage of Her Royal Highness Lady Julia. This hospital exists because we finally refuse to accept a future where 10% of Ghanaians suffer silently, while only 2% receive health care. Because a future where mental health is taboo, hidden, and dismissed, and even criminalized, is not a future. This hospital represents a turning point in our conversation, a sanctuary, and a symbol of compassion backed by action. Her Royal Highness Lady Julia has been a strong and steady inspiration in this work. Her commitment to the well-being of women, families, and the broader Asante community has shaped the vision of this institution. We commend her for her work and all she has done with the E Foundation in this area. We continue to demonstrate that true service is not about visibility, but about impact. Our work forward. Your belief in this vision has allowed us to build tools, platforms, and create conversations that reach across the country. Today, your belief has helped us build something even more powerful. A physical space where people can
Counselor and leadership of KNUST, the co-founder of the Veep Medical Center, Opoku-Agyemang, distinguished ladies and gentlemen, media personnel, students, good morning. Today is a deeply meaningful and significant day for me, for our team at the E Foundation, and for the entire Ashanti region. The commissioning of the KGL Veep Medical Center is more than the opening of a facility. It is the beginning of a new chapter in compassionate healthcare, advocacy for mental wellness, and dignified support for women, children, students, and families. When the idea of establishing a center dedicated to mental well-being first came to me, it was born out of a simple but urgent truth. Too many women, too many young people, and too many families in our society suffer silently from various forms of mental illness. Depression, anxiety, postpartum challenges, childhood behavioral issues, stress-related complications, and emotional trauma are real. They affect homes, marriages, academic performance, productivity, and contribute significantly to morbidity and mortality. Yet for many years, these issues have been met with silence, stigma, and discrimination instead of care and understanding. Ladies and gentlemen, it is time to take off the wraps and to address the needs of the hundreds and thousands of people who have been suffering silently. It is time to let go of the stigma and the shame. The vision of the KGL Eve Medical Center is therefore built on 3 pillars. Accessibility, that support must be available where people live, study, and work. 2, dignity, that no one should feel ashamed to seek help. 3, holistic care, that mental health must be integrated with general medical services, counseling, and wellness. Seeing this vision come to life today is truly humbling, but also exciting for me. Ladies and gentlemen, allow me to pay special tribute to a man whose commitment, intelligence, and relentless drive has carried this project from vision to reality. Agyemang, co-founder of the KGL Eve Medical Center, has been the engine, the strategist, and the constant force behind every step of this project over the past 18 months. From planning, design reviews, stakeholder engagement, regulatory preparation, to assembling the clinical and administrative foundations of the center, Nana has worked day and night to bring us to this moment. His passion for community, well-being, especially for women and the youth, reflects a rare heart of dedication of service to humanity. Nana's leadership has not only shaped the character of this center, but it has also reaffirmed that committed individuals can achieve when they put the welfare of others above themselves. Nana, I am deeply grateful for your partnership, your courage, and your unwavering dedication. This facility bears your imprint, and history will remember your contribution. Distinguished guests, ladies and gentlemen, today would not have been possible without the extraordinary generosity and visionary leadership of the KGL Foundation, led by Elliot, under the chairmanship of Mr. Alexa Pau Dadi. The entire construction of this center has been funded by the KGL Foundation and donated to the KGL Eve Medical Center as a gift of hope to the people of Asantewaa. Even more inspiring is their commitment to fully complete phase 2 and 3 of the project by 2027. An investment that will transform this center into one of Ghana's leading hubs for mental wellness, research, and general medical care. Mr. Dadi, Your philanthropy is not only admirable, it is nation building. On behalf of all the lives that will be touched by this center, I say thank you. Special gratitude also to the Vice Chancellor, University Management, and the entire university community for their very generous donation of the land on which our facility is situated, and also for all their support with the project and all the expertise they have offered us with this project. Thank you so much. The Vice Chancellor is here.
Members of the press, distinguished ladies and gentlemen, good morning. I didn't get a resounding good morning response. Good morning, everyone, and I want to thank you for being here on this exciting day where we reflect on the contribution of our women and profess solutions to their many health problems. We gather not just to open a building, but to open possibilities for better health, stronger communities, and a future where every woman has access to the care, dignity, and support she deserves, especially on mental health. And yes, I promise to keep this speech so short, and I do take responsibility for the late start of this program. But unless the spirit of inspiration obviously carries me away, in which case I blame the ribbon cutting ceremony and the Caesars and the organizers for the long speech. Of course, sometimes they can be very persuasive. Today marks the beginning of a new chapter in women's health in our community and country. This center is more than walls, it's more than rooms and state-of-the-art equipment. It is a place designed with intention where women can come not only to receive care, but to feel heard, respected, and empowered. For decades, women's health has often existed in the background, understudied, underfunded, and sometimes even misunderstood. Too many women have had to navigate a system that wasn't fully designed with them in mind. Today, we are changing the narrative. The plan is that this medical center will stand as a commitment, a promise that women's health is not a footnote anymore, but it is a foundation. Whether it's reproductive health care, mental health, maternal health, preventative screenings, and chronic medical health, this will be and provide a one-stop shop for this group of individuals whom we cherish so much within our community. You know, someone asked me earlier, what makes this center so unique? And I said, well, first of all, the fact that we actually listen to women. Imagine that, listening to women. Revolutionary concept, I know, but genuinely, the design, the services, even the color palettes were shaped by patient voices, community consultation, and lived experiences of women who said, we deserve a space built for us. And speaking of being built, this center reflects not just innovation in medicine, but innovation in sustainability. Women's health is deeply connected to environmental health. The air we breathe, the materials we are using, the resources we pass to the next generation, these things do matter. And therefore we have carefully utilized and thought about energy efficient systems, sustainable materials, smart water and waste management processes to be done here, continuity of care in addition to quality of health care. And this, we believe, will herald a new era in women's healthcare. In a world where healthcare facilities often leave a large ecological mark, we wanted to show that care and sustainability can and must go hand in hand, because empowering women also means ensuring they inherit a world worth living. This center wouldn't have existed without partnerships. genuine collaboration and community-driven partnerships. It epitomizes a typical public-private partnership between the...
And to wish everyone a good afternoon. Good afternoon. I know you are tired. I want to thank all of you, the organizers especially, for the kind invitation to be part of such an important event. We are here to commission a project that is set to contribute significantly to the region and indeed to Ghana's health sector as a whole. This facility is a practical response to the real and growing demand for integrated medical and mental health services. Distinguished guests, the global and national healthcare landscapes are changing, influenced by pandemics, digital medicine, ethical dilemmas, and our expanding populations. You know, our birth rate is high. I think it's 2.2 or something like that. But we love everyone anyway. In response, government continues to prioritize healthcare within Ghana's development agenda. We are strengthening primary healthcare, expanding NHIS coverage, modernizing facilities, increasing training, and improving access to mental health and wellness services. Earlier this year, Ghana hosted the landmark Africa Health Sovereignty Summit. This was to signal a shift from reliance on external aid towards sustainable domestic health financing. At the summit, the government announced the uncapping of financing for the NHIS, adding funds to expand fiscal space for essential health services and to improve health coverage across the country. Alongside this move, we have launched the Ghana Medical Trust Fund, popularly known as Mahama Cares, to address chronic, lifelong conditions that fall outside the NHIS's full coverage. The fund aims to provide financial support for the treatment and medication needed for serious, non-communicable diseases like cancer, diabetes, kidney failure, stroke, hypertension, and other conditions that have traditionally placed a heavy financial burden on patients. Moreover, Mahama Cares aims to strengthen Ghana's overall health infrastructure, investing in medical equipment, specialist training, healthcare facilities, and research to ensure quality and equitable access for Ghanaians, regardless income or location. These initiatives represent a major step towards long-term resilience. And that is what is being intended to achieve in order to reach a universal health coverage, and your facility plays a significant role in this very, very important match. However, ladies and gentlemen, government alone cannot meet every healthcare need of our growing population. The nation relies on partnerships with private sector actors, foundations, and institutions that share our vision for a stronger, healthier Ghana. Facing the medical and mental health challenges among children, mothers, students, working and retired adults nationwide requires accessible, stigma-free services supported by strong partnerships. This center contributes directly to the effort and expands care options to this region with this purpose-built mental wellness facility. Your Royal Highness and Nana Agyemang, and also your team of partners, you have worked to develop a facility that integrates mental health services, general medical care, counseling and wellness support, and community mental health outreach programs with the focus on women. Standing here, I cannot overemphasize that. That is very, very important. And your contribution addresses an important service gap. This foundation, led by its chairman, Mr. Alex Opoku-Agyemang, you funded the construction of this facility and has transferred it to the Eve Medical Center for public benefit. I'm also informed that the foundation has committed to finishing phases 2 and 3 of this project by 2027. And by so doing, you further grow your medical and wellness capacity. This contribution exemplifies corporate social responsibility aligned with regional and national health goals. Well done. I want to emphasize that when our interventions align with regional, community, and national goals, then we make good progress. Strong partnerships among government, foundations, and the private sector help increase access to quality care. The establishment of this medical center carries with it many implications, including the following: complementing the national mental health policy and universal health coverage objectives, strengthening service delivery capacity in this region, integrating mental and general medical services, supporting care for youth, also very, very important, mothers, students and families, and providing a model for community-oriented health investments. We also expect the center to contribute to research and training through meaningful partnership and collaboration with KNUST, for example. By linking mental and general medical services, this center is positioned to reduce delays and ease pressure on existing health facilities. As we commission the center, we are reminded that improving health outcomes depends on ongoing commitments, effective partnerships, and an understanding of community needs. To all who contributed to this project, the Royal Highness Lady Julia, Nana Agyemang, the various foundations, especially KGL, and other partners, congratulations on your initiative. You don't think they deserve an applause? Your efforts have strengthened the region's health system capacity. And on that note, I feel privileged to declare the KGL Eve Medical Center officially commissioned. May this center serve the region well and have a positive impact on the entire nation. And may God bless our beautiful country, Ghana. Thank you very much.
Republic, Your Royal Highness, Lady Julia Sejtu, Queen Consort, patron and convener of the KGL Eve Medical Foundation. And Agyemang Prempeh, co-founder of the KGL Eve Medical Center. Mr. Alex Opoku-Agyemang, chairman of the KGL Foundation. Esteemed board members of the Eve Medical Foundation and also KGL Foundation. Distinguished board members of the respective foundations. Vice Chancellor of Kwame Nkrumah University of Science and Technology, represented by the Pro Vice Chancellor.